my name is Jiwon. I'm in charge of overseas marketing for Hanbit MD. I'm down here today to talk about an application we have developed called the IV therapy helper. Before I do this, let me give you a little background. Most inpatients receive some type of IV therapy. The flow rate is important just as dosage is important when taking in oral medication. According to SCI articles in 2011 and 2012, a wrong flow rate was the most frequent problem during IV therapy in hospitals, and it accounted for many serious errors. One of the first things that a nurse or the member of staff has to do is a tricky mathematical calculation. It is not difficult, but it is easy to make mistakes when in a hurry. But using a software calculation tool, the IV therapy helper can easily and simply calculate the drip rate and drip interval depending on the prescription that has been written up by the doctor. We developed the technology to check the flow rate during IV therapy. We invented a new way to accurately calculate the average actual flow rate in order to reduce the human error to a minimum. Now I'm going to demonstrate the functions of IV therapy helper for you. The first function is setting the flow rate. The IV therapy helper can calculate the drip intervals according to the drop factor of the drip chamber for any prescription, such as milliliter per hour or drops per minute, or for the volume and delivery time of the fluid to be delivered. So what we have to do on the front screen is to select the drop factor from the giving set. Here is our typical infusion for patient. 1 liter of fluid in 8 hours. We input the target volume and time. And press the set flow rate bar. The drip interval is then shown after calculation on the visualization screen. An audio effect is like a metronome in music, created to adjust the actual drip intervals at the prescribed rate. You can match this auditory dripping time interval and the actual drip intervals with a roller clamp or an IV flow regulator. Second function is checking the flow rate. Previously, there was no easy way to check the ongoing flow rate during IV therapy. But by using our technology, you are now able to check the drip rate on infusion already running. Here is how we do it. First thing we have to do is to press the check icon on the main screen and tap the screen consecutively over 4 times, matching the drops as they fall into the drip chamber. You can then see a display of the current flow rate and drip rate on the screen. Also, we have timer function. Timer function shows the residual time. This function is interlinked with the setting and checking tool. So you input the residual fluid volume in the residual volume box. You are going to see an IDN name on the screen. There you can input an IDN name on the screen. After that, the alarm will ring at the end of the IV therapy. A patient list will then be displayed, which will show the exact time the treatment will be finished. As you can see, the IV therapy helper provides effective professional nursing care and a higher level of comfort and trust to patients. It is efficient in terms of time management, cost, and control of process. It guarantees that doctors give higher quality and safer treatment to patients. Hanbit MD has produced IVIC-S, IV Infusion Controller. It is handheld, the device that controls IV flow easily and precisely during IV treatment. Based on the technical know-how used to develop the IVIC-S, we developed the software tool, the IV Therapy Helper, and launched it in 2013. Thank you for listening.